Abdominal epilepsy is a rare form of epilepsy that primarily manifests through gastrointestinal symptoms rather than the more commonly recognized neurological signs like seizures. It is most often seen in children, but can also occur in adults. Because its symptoms mimic those of other gastrointestinal disorders, abdominal epilepsy is often misdiagnosed or overlooked, making awareness crucial for early detection and treatment. What is abdominal epilepsy? Abdominal epilepsy, also known as autonomic epilepsy, is a type of epilepsy where seizures originate in the temporal lobe of the brain but present predominantly as abdominal symptoms. These symptoms can include abdominal pain, nausea, vomiting, bloating, and changes in bowel habits. Unlike typical epilepsy, where the electrical disturbances in the brain cause overt seizures, the symptoms of abdominal epilepsy are more subtle and can easily be mistaken for gastrointestinal conditions like irritable bowel syndrome, IBS, or cyclic vomiting syndrome. Causes. The exact cause of abdominal epilepsy is not fully understood, but it is believed to be related to abnormal electrical activity in the brain, particularly in the temporal lobe, which is responsible for processing emotions, sensory input, and autonomic functions including those that affect the digestive system. This misfiring in the brain can send erratic signals to the stomach and intestines, leading to the characteristic abdominal symptoms. In many cases, a genetic predisposition to epilepsy, head trauma, brain infections, or developmental issues can increase the risk of developing abdominal epilepsy. However, it is important to note that abdominal epilepsy is rare, accounting for only a small fraction of all epilepsy cases. Symptoms. The hallmark of abdominal epilepsy is recurrent abdominal pain or discomfort that occurs in episodes, often without any clear trigger. These episodes are typically brief, lasting a few minutes to an hour, and may occur several times a day, or less frequently. Common symptoms include abdominal pain. This pain is often described as dull, cramping, or sharp and is usually located around the navel periumbilical region. Nausea and vomiting. Many patients experience sudden nausea that can be severe, often followed by vomiting. Bloating. A sensation of fullness or bloating in the abdomen may accompany the pain. Changes in bowel habits. Diarrhea or constipation may occur. Autonomic symptoms, though these are less common. Pallor and changes in heart rate can also be present, reflecting the involvement of the autonomic nervous system. Neurological symptoms. In some cases, abdominal symptoms are accompanied by more typical signs of epilepsy, such as altered consciousness, confusion, or generalized seizures. Diagnosis. Diagnosing abdominal epilepsy is challenging due to its rarity and the nonspecific nature of its symptoms. The diagnosis is typically made through a combination of clinical evaluation, patient history, and diagnostic testing. Electroencephalogram (MEG). An EEG is the most crucial tool for diagnosing abdominal epilepsy. It records the electrical activity of the brain and can identify the characteristic patterns associated with epilepsy, even when the patient is not experiencing overt seizures. Neuroimaging, MRI or CT scans of the brain, may be performed to rule out structural abnormalities that could be contributing to the symptoms. Gastrointestinal evaluation. Since the symptoms are gastrointestinal in nature, a thorough evaluation by a gastroenterologist is often necessary to exclude other causes, such as peptic ulcers, gastritis, or IBS. Treatment. The treatment of abdominal epilepsy typically involves the use of antiepileptic drugs (AEDs) to control the abnormal electrical activity in the brain. Commonly prescribed AEDs include carbamazepine, valproic acid, and lamotrigine. These medications help reduce the frequency and severity of the abdominal symptoms by stabilizing the brain's electrical activity. In addition to medication, managing abdominal epilepsy may involve dietary adjustments. In some cases, dietary changes may be recommended to help manage symptoms. A ketogenic diet, which is high in fats and low in carbohydrates, has been found to be beneficial in some forms of epilepsy, including abdominal epilepsy. Psychological support. Because the symptoms can be distressing and affect quality of life, psychological support or counseling may be helpful for some patients. Regular monitoring. Ongoing follow-up with a neurologist is essential to monitor the effectiveness of treatment and make any necessary adjustments. Prognosis. The prognosis for abdominal epilepsy varies depending on the individual. With appropriate treatment, Many patients experience significant improvement or complete resolution of their symptoms. However, if left untreated, abdominal epilepsy can lead to a decline in quality of life, including school or work absenteeism, social isolation, and emotional distress. Conclusion: abdominal epilepsy is a rare and often under-recognized form of epilepsy that presents primarily with gastrointestinal symptoms rather than typical neurological signs. Awareness of this condition is critical, particularly for healthcare providers, as early diagnosis and treatment can greatly improve outcomes. If you or someone you know experiences recurrent, unexplained abdominal pain, especially when accompanied by neurological symptoms, it's important to seek medical advice and consider the possibility of abdominal epilepsy. Abdominal epilepsy is a rare form of epilepsy characterized by gastrointestinal symptoms, primarily abdominal pain, associated with abnormal electrical activity in the brain. While the condition itself is unusual, the aftereffects can be similar to those experienced in other forms of epilepsy. These may include 1. Fatigue. After a seizure, individuals may feel extremely tired and require rest to recover. 2. Confusion or disorientation. Post-seizure confusion is common and can last from a few minutes to several hours. 3. Headache. Some people experience headaches after a seizure, which can range from mild to severe. 4. Memory issues. There may be short-term memory loss, particularly around the time of the seizure. 5. Mood changes. Irritability, anxiety, or depression can occur after a seizure, sometimes due to the stress of experiencing frequent episodes. 6. Gastrointestinal symptoms. Continuing or residual abdominal pain or discomfort may persist after the seizure. 7. Fear of recurrence. There can be anxiety or fear about future seizures, especially if the seizures are frequent or severe. 8. Impact on daily activities. Depending on the frequency and severity of the seizures, individuals may have difficulty maintaining regular activities, such as work or school. 9. Side effects of medication. If the person is on anti-seizure medication, they may experience side effects such as dizziness, drowsiness, or changes in appetite. Managing these after-effects often involves a combination of medical treatment, lifestyle adjustments, and psychological support. It's essential for individuals with abdominal epilepsy to work closely with their healthcare provider to manage their condition and mitigate these after-effects.